item for us, by the way. So Chuck has asked me to introduce him. I've known Chuck for quite a while now. Chuck doesn't really need the microphone. You'll be able to hear Chuck really well. He's a great guy. He's a great family man. He also knows his stuff when it comes to the Medicare system. I've got some friends that I help that need financial assistance. I won't go into it in detail, but Chuck's met with them and he's taken these people under his wing that just need a little extra help when it comes to their finances, and he's helped them with health insurance, Medicaid, Medicare. And if you know anybody that's over 65 years old that needs, whether you think they need help with their Medicare or not, have them meet with Chuck and he'll help guide them through the complicated Medicare system to make sure they've got the right insurance. So with that, our dear friend Chuck Moore.
Thank you, Steve. Can you help me hand this out here? Let me keep going. All right, Steve's done me a big favor handing out some little pamphlets there. I'm going to talk to you about Medicare. Now, who here is an expert on Medicare? Who knows it? I know Arby is. He has to be. Okay? Dustin's been on Medicare now for about 13 years. Okay? Medicare is the health insurance program for our senior citizens. It's also the health insurance program for individuals that are on disability. So it's possible that somebody is 23 years old and on Medicare. They are on Medicare, okay? John qualifies. Now, they must qualify for SSI disability. I'm going to get into all that, and these little clarity pamphlets that we're handing out, there's a lot of information in here, and I'm not going to cover half of it, tenth of it even. We're going to open up to page 4 if you want to, or if you don't want to, do it anyway. Because these 2 pages are what I'm going to cover. First off, who is eligible for Medicare, and when are you eligible to make changes to your Medicare plans?
Anybody 65 and over
in
November.
When you're 65 and over, okay? But when you're, okay, what if you turn 65 in June? You can't do anything? No. You have enrollment periods, and you must have an enrollment period in order to make a change to your Medicare plan. When you first are turning 65, or you're first qualifying for Medicare on the basis of a disability, you have a 7-month window. That is your initial enrollment period. It runs from 3 months before your Medicare eligibility date, the month that you are Medicare eligible, and 3 months after. So a 7-month window. So that's plenty of time for most people to make their Medicare decisions. Okay? If you don't do it, well then you're kind of SOL. Unless you have a special enrollment period. Special enrollment periods are for individuals who may qualify on the basis of being low income. They qualify for the state-run program, Medicaid. Medicaid is not Medicare. Medicaid is the state-run low-income insurance program. All right? There's a lot of talk right now in the legislature, and you're hearing on the news about the state Medicaid reform, changing it all. And boy, I'll tell you, this is a mess, and it's complicated. And it's nice to say we need to provide Medicaid insurance to everybody that is below a certain level. Well, that's great, but we do have to be able to pay for it, and how do we fairly pay for it? That's what they're trying to determine at this time. And I've got my own views on that I'm not going to get into right now because I don't have time. But you have that initial enrollment period. You have special enrollment periods. If you move from one county to another county, you have a special enrollment period. If you lose other creditable health coverage, all right? When you turn 65, most people will get on Medicare Part A and Part B. Once you do that, I'm going to turn to the next page, and this is where it gets kind of complicated, okay? You automatically, when you turn 65, qualify for Part A. If you have worked at least 40 credits, you have 40 quarters that you've worked during your lifetime. That's 10 years. If you've worked for 10 years and you've paid into the Medicare system through your tax deductions, or if you're self-employed, that's self-employment tax, if you do that, then you qualify for Part A. Part A is your hospital insurance. So, great. You go in the hospital, you got about a $1,280 deductible. Woohoo! Okay? But then you still have all of the outside things. Your surgeon comes in, you've got to pay for him. You've got physical therapy afterwards, you've got to pay for that. That's what your Part B is. Part B insurance is all of the outpatient. Everything that is outside the hospital, outside of a skilled nursing facility, which is not long-term care, that's for rehabilitation, and everything that is not hospice. Okay? Those three things. Hospital, hospice, which is for end-of-life care, and skilled nursing facility, which is for rehabilitation purposes. Everything else is Part B. Part B is $104.90 a month for most people during 2015. We don't know what it's going to be in 2016 yet. I heard a rumor yesterday it could go up $41, which is extremely troubling when you figure. They also said the Social Security COLA, cost of living adjustment, is going to be zero. So we don't know what Part B is going to be next year. I'm hoping it stays the same. It has stayed the same for 3 years now. So $104.90 for Part B. Now you've got your A and B. You've got creditable coverage. You've got hospital, you've got doctor visits, you've got physical therapy, you've got whatever you need, right? Wrong. You've got some big holes here. I told you, $1,280 deductible if you go in the hospital. For your doctors and all of your outpatient procedures, you've got a $200 and I think it's $53 deductible. It changes every year. And then you pay 20% of everything else. There's no out-of-pocket maximum. There's a huge hole. So you need to be able to take care of that. How do you take care of that? You can do it with a Medicare supplement. But if you're not 65, if you're qualifying on the basis of a disability, you don't qualify for a Medicare supplement. If you are 65, you're going to pay about $150 a month for it. Well, that'll cover the whole, but $150 is an awful lot for somebody that is living on a fixed income. And, you know, that could be taking up 10 to 20% of their income. So what do? You've got a Medicare Advantage. Medicare Advantage combines Part A and Part B. It adds the other part I haven't talked about, Part D, prescription drug benefits. If you need a prescription drug card to be able to handle, especially when you're 75, 80 years old, and you're come out, you're taking 20 drugs, you need to be able to have some help paying for those drugs. Part D helps you pay for those drugs. The Medicare Advantage combines Part D with your A and B, has it administered through a private health insurance company, such as United Healthcare, Humana, Select Health, Aetna, Altius, Blue Cross Blue Shield, there's a million of them. I represent them all. And that will combine it all, and you will pay anywhere from $0 a month to $235 a month. Why would you pay $235 a month? Because you want Blue Cross Blue Shield, and their plan has the lowest out-of-pocket maximum. The benefits aren't greater, but you pay less in a year if you're chronically ill. Okay, otherwise you can pay $29 a month or $18 a month and have a really good plan and have some dental coverage, have some additional benefits. So Medicare Advantage saves 90% of the people a lot of money over getting a Medicare supplement. 10% of the people that are chronically ill, that have a chronic condition, that are constantly in the hospital, going to the doctor, they are in need of a Medicare supplement. I take the time when I am with my clients to make sure that they understand what they have, what they need, and I try to get them put in the right place for them, for the individual. I've got one guy that I met with. He was on a Medicare Advantage plan. He was on disability. He turned 65, and he had very limited income. But this guy was in a wheelchair. He's got a hospital bed that he's been renting and paying 20% of the cost of that. He's been in and out of the hospital multiple times over the last 3 years. I told him, we're putting you on a supplement. He said, how much will that be? I told him it's going to be like $140. He said, I can't afford that. I said, well, here's your option. And I showed him the option where he's paying more than that just in his medical his durable medical equipment. And so that covered all of his costs. I ended up saving him over $200 a month just by putting him on a supplement. It takes time to do it. I spent time yesterday with a lady showing her how she can save about $45 a month on her prescription drugs. These are people that don't have the money, and $45 is huge to them. I will take that time. If I'm not going to be able to move them to a better plan that's better for them, I won't move them. I keep them where they're at. I do what's right for the client. I do what's right every single time. And that's where we're at. So, good lead for me. Right now, open enrollment, annual enrollment period starts October 15th. I'm doing the pre-marketing right now. I'm meeting with a lot of people. Everybody that is 65 and over and on Medicare, everybody that is on disability and on Medicare needs to review their Medicare plan. Everybody needs to do it. It is not a complicated thing, but it is important. They need to sit down with a competent Medicare advisor that understands the different programs, can determine what they have, and help them make the correct decision. That's what I do. So anybody in those things, that's a fantastic lead for me. If it's your parents, if it's yourself, if it's your friends, your neighbors, I don't care. You do need to tell them. I've got this friend named Chuck who is incredible when it comes to Medicare. Can he call you? And have them tell you that I can call them. Because that they do have to do that so that I can contact them. I have to have permission to call. I cannot quote cold call, which is you just saying, hey, call my mom. She has to have given me permission to call. So, with that, do we have any questions?
Chuck, how do you get paid?
How do I get paid? I like that question. I get paid by the insurance company. I never take a penny from the people that I'm with. I do not take a penny. The insurance company pays me when I enroll them in one of their plans. They pay me a fixed dollar amount based on the plan that I enroll them in, and then I get renewals on after that as I maintain them and take care of my clients. Great. Any other questions? Awesome. If you have any questions, my name's Chuck, Health Plans, Insurance Advisors, and remember, when it comes to Medicare, I care. Woo!